Hello, my name is Adrian Săftăiu from the Gastroenterology Department of the University of Medicine and Pharmacy of Craiova, Romania, and on behalf of the European Endoscopic Ultrasound Elastography Multicentric Study Group, I'm going to present the video abstract of our article in the January 2012 issue of Clinical Gastroenterology and Hepatology entitled Efficacy of an Artificial Neural Network-Based Approach to Endoscopic Ultrasound Elastography in the Diagnosis of Focal Pancreatic Masses. The assessment of tissue elasticity achieved significant interest in gastroenterology owing to the increased availability of this technology. By using strain assessment, real-time elastography provides additional information about the lesion's characteristics in the pancreas. EUS elastography was used previously in several studies for the characterization and differentiation of focal pancreatic masses with variable accuracy and reproducibility. We thus assessed the accuracy of real-time EUS elastography in focal pancreatic lesions using computer-aided diagnosis by artificial neural network analysis. Computer-aided diagnosis, also referred to as CAD, interprets medical images by computer technology in order to obtain automatic differential diagnosis of lesions. We performed a prospective, blinded, multicentric study of 258 patients, totaling 764 recordings from EUS elastography, who were diagnosed with chronic pancreatitis in 47 cases or pancreatic adenocarcinoma in 211 cases from 13 tertiary academic medical centers in Europe, the so-called European EUS Elastography Multicentric Study Group. We included patients diagnosed with solid pancreatic tumor masses with age between 18 and 19 years, both sexes, men and women, who signed informed consent for EUS with real-time elastography and EUS-guided fine needle aspiration biopsy. Patients who had undergone prior surgical treatment with curative intent or chemoradiotherapy, and also patients diagnosed with mucin-producing tumors or pancreatic cystic tumors were excluded from the study. Briefly, a central dedicated website was designed to collect the patient demographic data and EUS elastography movies from the active centers. EUS elastography was performed during usual EUS examinations with 3 movies lasting 10 seconds each that were uploaded to the same central website together with patient demographic data and further processed by the IT team. To minimize the possible human selection bias of individual images and perception errors of hue colors, all the post-processing and computer analysis of digital EUS elastography movies was performed within the IT Center of the University of Medicine and Pharmacy in Craiova, while the programmers and statisticians were blinded to the clinical, pathological, and imaging data. A special plugin written by the IT team based on the free available ImageJ software was used to analyze individual frames of EUS elastography movies by retrieving hue histogram data from a dynamic sequence of EUS elastography into a numerical matrix. The cases included 172 men and 76 women with mean age of 64 years for pancreatic cancer patients and 56 years for chronic pancreatitis patients. The sensitivity and specificity of the EUS elastography readings obtained by 2 independent doctors observing only the encoded recordings were as follows: 84.4% and 46.8% for the first reader and 75.4% and 53.2% for the second reader, respectively. The neural computing approach, however, provided 91.4% training accuracy and 84.3% testing accuracy. These results were obtained using the tenfold cross-validation technique. The statistical analysis of the classification process showed a sensitivity of 87.6%, a specificity of 82.9%, a positive predictive value of 96.3% and a negative predictive value of 57.2%. Moreover, the corresponding area under the receiver operating characteristic was 0.94, which was significantly higher than the values obtained by simple mean hue histogram analysis, for which the area under the receiver operating curve was 0.85. The differential diagnosis of pancreatic cancer and chronic pseudotumoral pancreatitis is still difficult, and it can be a challenge for the expert gastroenterologist. Age younger than 50 years, male sex, black race, and the absence of jaundice can be considered predictors for chronic pancreatitis. In the presence of a focal mass, the sensitivity and accuracy of US FNA are variable, usually approximately 80 to 90% in the reported studies, with lower values reported in the patients with chronic pancreatitis. US elastography imaging thus offers complementary information added to conventional US with minimal prolongation of the examination time, minimum costs, and no added morbidity or mortality. Recently, computer-aided diagnosis has become a part of the routine clinical work for detection of cancers at many screening sites and hospitals in the United States and Western Europe. In conclusion, integration of clinical data into efficacious artificial neural network models in concordance with imaging enhancements and cytologic parameters would certainly be beneficial for improved clinical decision making in patients with focal pancreatic lesions. This is highly important in the subgroup of patients with negative USFNA results, for whom a decision should be made regarding a repeat USFNA, long-term follow-up evaluation, or immediate referral to surgery. The introduction of real-time CAD systems based on previous training testing of artificial neural networks for imaging analysis will certainly benefit individual decisions in patients with unclear diagnosis, thus supporting enhanced clinical decision-making algorithms.